like to invite Ms. Sunanda Samal, our regional coordinator of Central India, who belongs to Palliative India State Facilitation Team. She has an MBA and master's degree in sociology and has 20 years of working experience. And especially with the healthcare sector, she has around 5 years of working experience. She has worked with UNICEF and also other government projects. So I wholeheartedly welcome Sunanda for today's session on organizing palliative care services. Over to you, Sunanda.
Thank you, Asmat, and good evening, everybody. Namaste. Shripriya, can I request for the screen share?
Sure.
Yeah.
Screen will be shared in a while. Anu, do we have you?
Shripriya, she already have the sharing rights.
No, like we have to share it from our end.
Sure. Just 1 second.
Yeah. So good evening once again to all of you and welcome to this session. As I've been already introduced, I'll not spend much time. My name is Sunanda. I'm based out in Pune, working as regional coordinator. So let's move on to the next slide, please.
Sundaman, just give me 2 seconds.
Yeah, sure. In this session, actually, so this session will brief you about how to open a palliative care center, as the title of the session already says it. So in your region, I'm sure you all are from different regions, so you can just relate. So you may be already, maybe some of you may be already part of some hospitals, or individually you may be having some your own clinics. So we shall guide you on how to start a palliative care in your settings. So for the questions, we'll wait till the session is over. Okay. So this, as we can see, there's a WHO palliative care advocacy triangle, and what it says is that as per the WHO, to set up successful palliative care center, to organize palliative care services, we need to ensure these three things which are really important. The first one, as you can see, is education. So these are the barriers for palliative care we'll have to overcome through education. So as we all, I think, will agree that the first one is lack of awareness among the professionals. Second, we feel is lack of awareness among the administrators. And third is lack of awareness among the public. So it is essential to educate the public. Public demand does persuade professionals and administrations to think over the issue. So that's how we are focusing on education, to educate the mass. Second is the drugs availability. So as we all know, pain relief is integral part of palliative care. And for that, availability and accessibility of pain relief drugs is necessary. So morphine is a mainstay of pain management. We all know about it. Its availability has been eased to small extent by the amendment of the NDPS Act in 2014. But most states, why I'm saying that, because as I told you that we have regional coordinators all across, so we have interacted and we know that most states are yet to implement them, which is a very sorry thing to share, so that's how it is. So that is the reason we must focus on the drugs availability. The third in the triangle is the policy and its implementation. So when we talk about policy and implementation, we all know in much of the world, palliative care came into being because individual initiatives and action by some of the non-government organizations. So however, to achieve national coverage, palliative care needs to be integrated into general healthcare delivery system. So government action is also needed to remove barriers to access to pain relievers. It is essential for budding services to develop their own policies that can overcome any gap in available facilities. So when we are actually planning to have a new palliative care service center, we have to remember that first, very important, the team should be trained in palliative care. Then the second one, they should have opioids available. And then there should be a policy or a program available to support your services. Can we move on to the next? Yeah. So as you can see in the slide, it is Indian context. So now we can focus on Indian context, how the system is going on. So the first one is, we'll just see how we can, have a center. So first three major categories are there. First one, as you can see, is a standalone. So standalone model is an independent facility where we provide palliative care with specific focus on pain and symptom management and improving quality of life for patients and their families. This can be done through a hospice or a palliative care center. This is the first category, standalone. Second one is a department with a hospital. There will be a dedicated department or a unit for palliative care attached to the particular hospital, which might be a government hospital or a charitable or non-profit hospital. Some of the NGOs also run these kind of hospitals. And the third one is the community-based home care. So this is where community gets involved. As you all know that even in Palliative India, we have community-based home care system. So here we reach to the care receiver. Like they don't have to come. So we reach them where they are. And here the social capital act as a bridge between the micro and the macro. And the major element of social capital are the volunteers. Next, please. Yeah. So these are few standalone centers. The first one is the Cipla Palliative Care in Pune. Another one, the middle one down is in Chandigarh. And the right is in Hooghly district of West Bengal. So we are already working with them. Next, please. Yeah. So this is an example of palliative care unit, which is established, which is within an established hospital. This is a government hospital in Arunachal Pradesh. Okay. Next. Yeah. So here is a third category through which the palliative care is delivered is through community-based home care. So what's the difference? The difference between a regular home care service and a community model is the mode of delivery, how we are delivering the services. So in Indian context, the macro component, which here will be the tertiary health care institution, are getting bigger and bigger. And micro element, the beneficiary is not able to reach them. So that's the gap actually. So this is where the community concept comes into action. So which we call as meso component. They take the ownership where the community concept comes into being, and they take the ownership, as I said, to bring the micro and the macro components together. So they bridge the gap actually between them. So as you all know, now in Kerala state, we have utilized the power of community model, and which might not work, on other states, but then we would like to bring you this example as a prototype, which you can get an idea about, and you can go forward in your settings, in your areas. Next one, Shripriya. Yeah, so this is now a complete, you can see micro, meso, and meso and micro and macro. Yeah, next, please. Yeah. So this is the story of one of our very, very proactive volunteer. So we call him fondly as Nair Uncle. So let me just explain about him. So his name is Mr. K.N. Nair. We call him Nair Uncle. He's 70 years old and he's an ex-serviceman. He got introduced to Palliative India as a caregiver to his wife, who was under our care. He serves as a volunteer after his wife passed away. He goes with one of our home care teams and is involved in patient care more than our clinical team. He's known to our beneficiaries more than our own team. He has a small notepad always. Whenever he goes, he has a small notepad in his hand, and he keeps all the data of all the patients he meets. And over a phone, he follows all of them. Like, every day he calls them. So our beneficiary has more, they're very comfortable with him because he's now very familiar. So they share their problems, and he's never ordered. Like, it's not that like Palliative India orders him to do this and go. And so he volunteers and he goes of his own. And he feels as if he's doing this follow-up is his responsibility. So I think this is a beautiful example how a volunteer should work, unconditionally, like, without any expectation. So he has been our role model when we talk about volunteers. Next, please. Yeah. So in this slide, we can see there are 10-step approach. Actually, this whole presentation, today's presentation, the crux is here. The main part is here. So I'll just go one by one. So how to organize a palliative care services includes these all 10 steps one by one. First, obviously, is funds. So arranging funds, before starting to organize the whole program, we need to think about where we can arrange for funds. If you're part of a government hospitals, the funds are available through various programs. I'm sure you all must be knowing, which is the National Program for Palliative Care, NPPC. Or we also have Ayushman Bharat. They do have funds for that. And if you're in the private sector, then of course you can create the service and you can charge for it. So for sustainability, that's okay. And or else you can opt for the CSR funds or public donations, whatever is feasible in your area. So this is one. So arrangement of funds is one of the point. Coming to the next point is recruitment. So when we have a services, definitely we need a team. So for the team, we have a team of doctor, nurses, and social officer. So social officer can be a social worker, counselor. So like this is a core team, what I want to say. So going forward, as you grow, you may require more allied medical professionals like pharmacist or physiotherapist or occupational therapist, dietitians, etc. So, but the basic unit, as I was saying, has to be a doctor, a nurse, and a social officer. And the important part here is not just hiring them or having them in place, but they have to be properly trained in palliative care. Then the next one is that you need to have an infrastructure, obviously. So, in that case, if you're looking for an OP, so you need a room for the OPD or a space, furniture for the inpatient. If you're planning for an inpatient unit, and in case of home care, you need a vehicle, obviously, which can be used by the team to travel to the needy with all essential, things like medicines and other consumables. So now we have covered the 3 points. Next one is about opioids. So as I mentioned in the starting, we need to ensure availability of the essential narcotic drugs for pain relief. To procure, store, and dispense opioids, you need to be part of the RMI, which is the full form of it is recognized medical institution. And here I want to mention that all the government hospitals are deemed RMIs, which means they do not need to apply separately for a RMI. So they are deemed RMIs. The RMI things is applicable for the private establishments. So it's like for the information required. So I said that because people get confused for this kind of like RMI, even for government is it required. So I cleared it up here. So for the detail about opioids availability, how to procure, how to dispense, I think you will have a detailed session later on, I think, especially for opioids availability. So we'll not discuss more about it right now. So moving on, after all these points, let's come to the other one is you need to establish connects with existing experts in palliative care in your region. So this will help you to understand the challenges, why it's important, because we are a new player in this sector, or we are trying to open it up. So we need to understand what are the local regional challenges and what support actually they're looking for. So that will help you to understand the scenario. Coming to the next one, you need to arrange awareness sessions for the public as well as for your team to help them know more about palliative care. So again, why this is important? Awareness is important because you need to get referrals. So you need to have sessions with the community and other people so that they know about the services, and identify the local champions to take your work to more people. Like, it should spread across that this kind of services is coming up in this particular city or other region. So coming to the next point is for developing an OP, maybe you have a local hall. I mean, these are all alternatives that I'm sharing, or a classroom of a school or colleges, or a room. If you're part of any particular established hospital, they might have some unused rooms. So just to ensure that all facilities that you find should be disabled friendly. That is one of the things usually gets overlooked. So we are trying to highlight that it should be disabled friendly. And you can just have an examination table, a chair, and some basic furnitures and essential medical equipments for conducting an OPD. So this is, I mean, this is the bare minimum, I think we can do arrange all these things and start OPD. Coming to the next one, for the inpatient, for developing an inpatient facility, you will involve a little more infrastructure because you need beds and everything. So in terms of beds for patient, then side lockers, etc. So I think in this point, you all know better than me. So I'm not taking much time on this topic. Coming to home care. So this is one of the very interesting part. So coming to home care, you can start with one vehicle, which can accommodate a team of doctor, nurse, and a social worker, social officer, we say it actually, and medicine and consumables. So there are scenarios where just a doctor, like we have visited many states where just doctor and nurse, they go on a two-wheeler and they do home care. So there's nothing like, it's nothing fixed. Like you can always do it as per your availability of infrastructure and funds and everything. So basically it's just the passion that drives. So with bare minimum also sometimes people have started, and we have seen them working with so much of passion. And then involvement of volunteers is already understood. We understand why it's important. So as mentioned earlier, it's just a basic flow. As I said, we have just scripted it so that you get a basic idea how it should be. So it's not concrete. There's no such fixed rules. You can always, do the changes as per your settings. Yeah, next one, please. Okay, so this is about the strategy for financial delivery models. Here we'll look into how we support, facilitate palliative care services with already discussed models like government, charitable institutes, for-profit models, and sustainable models. So for capacity building is one of the major support that we are providing, through workshops, orientations. We do have foundation trainings for doctors, nurses, health workers, training of faculties for UG curriculum, training and engagement of the volunteers. We have a beautiful training for volunteers, which is a 5-day course. And we have specialized trainings for palliative physiotherapists, pulmonologists. In government, we support in training of the CHOs, ASHAs and ANMs. Then for opioid availability, we support in getting the NDPS implementation, create awareness for medical institutes about the RMI. So I was just talking a few minutes ago about the RMI. Like it involves a process like filling up forms and then applying, submitting the form to the state drugs controller. So these processes, we help them. And we are trying to actually work with the NHM to get the opioids included in the state essential drug list. So basically, we closely work with two departments. That is, one is the NHM, the health, and next is the state drugs controller. So each of the regional coordinators, they have to, it's mandatory. We have to touch upon these two departments, meet the officers, have meetings and follow-ups. So this is what I wanted to share here. So coming to the next point, we do have handholding for PCU, like PCU is palliative care unit at district level, connecting local palliative care networks. We provide documentation assistance and support. Developing, we do also do the PIP for the state. Okay, implementation of NPPC also we do help them. Development of palliative care through health and wellness centers. There's a scheme called Ayushman Bharat scheme. I'm sure you all must be knowing. Palliative India contributes towards developing a state palliative care policy. We do have a regular connect with the Ministry of Health and Family Welfare for developing palliative care in the states. We help recruiting human resources. So what happens when we are starting a new center? We do have, as I was saying, we need to hire doctors and nurses. So we help the organizations to like put the recruitment forms and all whatever your requirements in our website. So that's how we facilitate. We also facilitate the cost management to how to calculate the cost and how it can be sustainable. So we do have a different presentation for that. I like it's customized. Later on we can share about it. If someone of you want to start, you can approach us. So we also help them building funds through donations and help in grants and CSR application. So basically we're trying to help them the fundraising part. Now we have a process called, this is a newly introduced service that we are providing, is called implementation team support, where what happens, so where we send an implementation team of doctors, a nurse and a coordinator to your site. So when I say site, it can be to a different state altogether. It doesn't have to be in Kerala only. So wherever you are, and you approach us, and then we send a team. So the team will stay with you. They'll handhold your team, and through the process of setting up a palliative care for a given period of time that we need to discuss and finalize. Next, please. Okay, so this is challenges, and all of you can have a look. It is self-explanatory. I don't need to explain it. So these challenges have been jotted down after talking to all the regional coordinators, because as I said, we keep meeting different stakeholders, which includes government and non-government and private hospitals and everybody. So whatever we have come across, we have put down in one slide, and we have trying to share it with all of you. So you can take a minute to go through it. Shripriya, am I audible clearly?
Yes, you're audible.
Okay, thank you. Thank you. Okay, so I think if all of you have already gone through, we can just, I'm sure you must be able to relate many of the challenges, and I'm sure you'll agree to this challenge that these still, some of the challenges still exist. Yeah, let's move on to the next one. Okay, so this is about the standard audit tool. This is a kind of self-evaluation audit tool for palliative care centers. As we all know that this kind of assessment is very essential. So to know where we are standing, this is important. There are two parts. Part A is essential and part B is desirable. Essential is a minimum requirement that a center service should abide. The ones listed in the desirable are regular requirements. So are we, Shripriya, can we share the link to the original document later on?
Sure, we can do
Yeah,
that.
yeah,
Oh.
yeah. So that will be shared to you and you all can have a look. Now let's move on to the next one. Okay, so this is a beautiful model. All Palliative India family members love this model. So this is, we call it DEF model. So like we say, ABC ko chhod do, come to DEF. So DEF is demonstrate, educate, and facilitate. Very easy to remember DEF. So now let me just explain about the DEF. So when we talk about demonstration model is a proof of model that we take to our stakeholders so that potential stakeholders like you can learn to deliver palliative care. So here we have TIFS Trivandrum Institute Palliative Care Sciences, which is a WHO collaborating center for training and policy for access to pain. Okay, we do have our helpline. Ashriya, if you can just put the helpline later on in the chat box. Helpline number.
Sure, we'll do that.
Yeah. Okay, and so we do have, as you know, we all are part of one of the FCPM, that's Foundation Course in Palliative Medicine. So we do have other courses also. So and which is online. We do have offline courses also. And when it comes to like, this is demonstrations over education. In education, we are talking about the trainings, offline, online, all awareness sessions, and sometimes it is a request based training, like we customized depending on what exactly the stakeholders are wanting us to tell them about. So we are covering all that in under education. So D is demonstration, education comes all training and all. Now coming to facilitation, which I'm part of the team. So in facilitation, as I told you at the beginning, that Pelham India is no more restricted to Kerala or to Trivandrum. We have grown and we are now, our presence is there all across. So how it works. So let me just explain. So I'll start with me. I'm looking after the central states. So I would like to tell you my states. I'm looking after Maharashtra, MP, Chhattisgarh, Goa, Gujarat, Orissa. So, like, I'm based out in Pune, but I'm looking after all these states. So the central part of the country is covered through me. Similarly, we have one regional coordinator. We'll be sharing all the contact numbers in the chat box in a while. So the North coordinator is Mr. Rajendra. So he's looking after, he's based in Uttarakhand and looking after the northern states. For the Northeast, we have another region coordinator. His name is Rontu. He's based out in Guwahati, and he's looking after the Northeast, including West Bengal, like the Seven Sisters and West Bengal. For South, we are lucky to have Lalit. He has just joined. He is the South regional coordinator. So like this is a region specific. If you have any region specific queries, you can contact each of your regional coordinators, or you can put the your queries in the chat box, and we will inform them, and maybe they can contact you. Yeah. So this is how we cover the entire country, and we do have our internal meetings where there's a cross learning, like what happens in central zone, like I share, and then it's a cross learning, and what works here may not work in the other part of the country. So it's a beautiful interlearning between the team. Like, we are a team of 5-6, but then we also learn from each other. So that's the beauty of this particular team, state facilitation team, we call it. Yeah. Let's move on, please. Oh, next. This is the demonstration. Yeah. Next, please. Yeah, this is the helpline. Yeah. Next. Yeah, this is, we have covered. Yeah, just education we have covered. Yes. Next, please. Yeah. So here, as I was just mentioning, so our presence, North and Northeast. Next. Yeah, Central. Yeah. So I was talking about the state facilitation, how we work. I've already explained that. National presence. Yeah. So 1 minute. Next, please. Back. Previous one. Yeah. So I just want to tell you what is the philosophy. As I was talking about state facilitation division, what is the philosophy? What we aim at is to integrate palliative care in the 3 levels of healthcare: primary, secondary, and tertiary. And the main 5 objectives of this team, of this unit, which has been formed, is catalyzing palliative care centers and services. Like, we help end-to-end facilitation for catalyzing centers across various categories like government, charitable, And we assist in opioids accessibility, as I said, by facilitating them to get a RMI. There's a long procedure, but we help them how to, get the access to opioids procurement. We help our stakeholders to go through each documentation, to filling our application, taking to drug control, as I've already mentioned, and maintaining the records, which is important. We also enable palliative care in a medical institute, as we know that education plays an important role. So we train them, and we work with the stakeholders to build community engagement, which is very important, and how to mobilize volunteers. So as I said, in Palliative India, we create awareness through public. We take help of the volunteers, and then we have, they form a group as a link center, and they take the ownership. So, and then the palliative care across their region. So then, Shripriya, can we just go back to I think this slide is coming later. Yeah, talking about this one. So then the last, purpose of this particular, why this team has been formed, is to develop pain-free hospitals. The objective is to have a hospital where we have all the things that is required to have a pain-free life for the patient. So we do have something called pain score, you all must be knowing. So overall, for getting a particular palliative care service, whatever is required, like from advocacy to awareness to getting the license. So we are trying to, this particular team is trying to reach out to people who will be doing this work. Then coming to national presence, I've already shared. Let's move on to the next slide. Yeah. So as I said, we work with NHM, we work with the state drugs controller. So by now we have reached 25 states and 4 union territories. The training centers we catalyze are Trivandrum, then we have in Hyderabad, then we have GCRI Ahmedabad, then we have BMCHRC
Sunanda,
Jaipur.
sorry to interrupt.
Yeah.
Are you having access to the slides? Like right now, what I see is the regional coordinators.
Oh.
So
One minute.
Yeah.
So can we move on?
Yeah.
It is the
Anup,
last but one, actually. Can we move on?
Anup, can you please browse through the slides for us, please?
Yeah.
Please go on to the next slide, Anup.
The national president, no, the map, the other one, next one.
Madam, excuse me.
Yeah.
Sometimes you are getting disconnected in between.
Is it? Oh. So,
Anup,
Shripriya?
keep moving on. Like Sunanda, I couldn't like experience such a thing till now.
Okay.
Not
Okay,
sure.
maybe the participants is having some.
Anup, can you just keep moving on?
Yeah, ma'am.
Yeah, let's go to the national presence, Anup. No, not that.
Keep moving.
No, you've gone back. Okay, let it be. No worries. So I think we've just covered, like I was telling about what all things we do. Shripriya, can I carry on? Yeah. Correct. This is a slide. Yeah.
Now you can carry on.
Yeah. Okay. So as I said, we were talking about the training centers that we have catalyzed. So there are many across. We have MNGO Hyderabad in Telangana. We have GCRI Ahmedabad. So we have PSG Medical College Coimbatore. And so what all we do, it's not only trainings or meetings. So we have on-site foundation trainings also. We have facilitated for the pain-free hospitals. And this year I think we have introduced something called faculty development program. So this is a very beautiful thing. So this year we had invited faculties from various medical institutes across the country, and the faculties join the training, and then after the training is over, they go and teach their students. So, and the best part is this is a free of cost, the training was. So many doctors and the faculties, they joined, and they are now ready to take sessions with their students. Then we have something called Hamrahi sites. So Hamrahi is a project where we are working with the Australian Palliative Link International, we call it APLI, for mentoring the palliative care centers across India. So as of now, the meeting of APLI have mentored 15 sites through this project. So this is also a nice thing because like earlier it was virtually. So now in 23, the team from Australia are planning to come in and visit the sites, whomever they are mentoring. So it's going to be a beautiful experience. Okay, so then we do have hands-on training where we have 54 sites now. So in hands-on training, what we do is like when we complete the online trainings, so when you go back to your own regions, so we have in each state at least one hands-on training partner we have. So what we do is those can go to approach that particular institute for their hands-on training, because virtually you don't get the scope to really go and get the hands-on feel. So for that we have hands-on training partners where you can approach. And as I was talking about RMI, so as of now, 16 sites we have facilitated for getting the RMI, getting themselves registered for RMI this year. So I think that's it. Yeah. So Shripriya, is there any question in the chat box? Or any
Not yet, but I think we can wait for our participants to.
Sure. Or anybody wants me to repeat a particular slide or any particular topic, we can also do that.
Yeah, Sunanda, there's a question in the chat. Sunanda
Okay.
ma'am, do you
Yeah.
have a, just a moment, I'm reading it for you.
Yeah.
Sunanda ma'am, do you have a hands-on training center in Maharashtra?
Yeah, SIPLA. In Pune, we have SIPLA Palliative Care. Who's asked this question? May I know the name, please, and from where they are?
I'm Dr. Bandopadhyay, Nasik, Maharashtra.
Nashik, yeah. Sir,
I was at BJ Medical College, and at that time your center had just begun. I think it must have been in 2002. 2002.
Yeah. Okay. So you are interested to know who is our partner in Maharashtra. So we have SIPLA Palliative. You must be knowing in Pune they are. Yeah. So they are our hands-on team. Yeah. Thank you.
Someone asked, what is RMI?
Okay. Yeah, so it is recognized medical institute. I'll give an example. As I said in my presentation, that all the government hospitals need not apply. They are deemed RMIs. They can procure the ENDs. ENDs is essential narcotic drugs. But for the private hospitals or the NGOs, those who are doing palliative care services, or for example, let us take example of SIPLA. SIPLA is a private body. Okay, so they have applied for the RMI and they do have the license. So it is basically a license so that you can procure, dispense, keep it. And we all know there are a lot of issues around it. People do not want to keep it, and a lot of restrictions, and you have to keep a documentation. But so because of that hesitation, ultimately the patients are suffering. So what we're trying to promote is that someone needs to take the accountability, and we have to do it. We can't run away, right? So it has to be everybody. All of us are here will agree that patient is the priority. Okay, so we're trying to do that. So like some really don't know how to do it, so there our role comes in. We'll take we'll take virtual sessions, or we'll go down to them, look at the documents, and we send them the list of forms that they need to fill up, and then that's how we help them to apply. So recently I'd been to Mumbai, so one of the institute they wanted, so I helped them. They've submitted, and then they follow up and they get it. So it's very easy, but the process takes a lot of time. Yeah, I hope
So
I've
there's
answered.
Yeah. There's a question from Dr. Shweta. She asked, how do we apply for hands-on training?
Okay, so may I know you're working where? Are you in a hospital, or if you can just unmute and talk to me directly? Dr. Shweta. Shweta, na?
Yeah, Dr. Shweta.
Yeah. So can I? Okay. So let me tell you, for applying for hands-on training partners, you should have. Yeah.
Yeah, same question is with me also, ma'am. I'm a private practitioner in Gujarat, and
Okay.
even I want to establish a palliative care unit here in Vadodara, and I'm
Okay.
also looking for hands-on training.
Okay. Okay. So there are two things, ma'am. One is you going for a hands-on training partner as a participant, and the second part is your institute becoming a hands-on training partner for Palliative India. They're two different things. Let me take again CIPLA's example. So in CIPLA, they are focusing only on, we all know it's a cancer palliative care center. Okay, Pune CIPLA Palliative Care Center is focusing only on cancer. They have inpatient, they have OPD, they have home care facilities. Okay, so it's a proper setup. So when we talk about, let me talk about the first part. First part is you want to go to learn as a participant, as a learner to a center. So you go to, suppose a participant, anyone is here from Maharashtra, they want to go. So they, like, we'll help them, they go there and they see how the setup is working. So that gives you one, knowledge of how a particular setup works. Two, whatever you have learned in this course, you can, like, relate to it when you see that, okay, this is a session and this is how it works here, right? That's one thing. Second, when CIPLA and Palliative India had a partnership, so there's a form they need to fill up. There's a question like who will be accountable, whom to contact, what is your strength. There's a particular prescribed format they need to fill up, and they're with this office seal and stamp and everything, and they have to send it to us. And our team management will decide whether they're falling into, whether they're actually fulfilling all the requirements of being a hands-on training partner. And then it's not exactly MOU, but there's a understanding that henceforth, like, all our participants from Maharashtra will be contacting CIPLA. So that's how, two different things. Yeah. Is that clear?
Just adding on to what Sunanda
Yeah,
said,
yeah.
just an information that whoever wishes to continue or advance to the hands-on training, they need to become certified in this foundation course. If they have a plan to pursue hands-on training with our collaborators, they first need to get certified in this online foundation program. And after that, you will have to get in touch with the respective regional coordinator. And they will be facilitating your training experience, your training period with that particular collaborator. I hope I have made myself clear there.
Yeah. Thanks, Rupiah. Yeah, correct.
And the nursing courses which are going on, is it in the English language or Hindi language?
Yeah. Again, we have, it is actually in English, but if any one of you want, and you can give us, Shripa, is it 25 or 30 for a nurses
30
batch?
would be a reasonable number, because we had one batch particularly for Hindi, in Hindi language when the demand came. So one batch had been done successfully, and so in case we have around, in case we are looking at a number of about 30 plus participants, we can definitely think about conducting one nursing batch in Hindi as well. The one thing is that only the delivery will be in Hindi. The learning materials will be provided in English only.
English.
So that we would like to inform.
Correct.
Okay, yeah. But as an individual, I mean, from an individual level, I may not be able to have that 30 nursing staff.
No
right?
worries. Like,
so,
anyways, once we announce a batch,
yeah, okay,
from the training side, we circulate the data to every group. Presently, for the 26th batch of this foundation course in palliative medicine, plus nurses also we have batches, and we have WhatsApp group for every batch. So we circulate this announcement in all groups.
Yeah,
so once we get those ideal numbers, we launch the batch. That is
Okay, thank you.
So for Hindi, if we get a request, what I wanted to say is that if we get more than 30 or at least more than 25, we can arrange a batch. So that's the thing.
So Dr. Madhumita had asked, where is the regional center in Chhattisgarh?
No, there is no, okay, it's my mistake. Actually, Palliative does not have an office. So we all have our own, like we work from our own places and then we coordinate. It's all about, more about traveling to the places, as I said. So we do not have an office as such. Palliative doesn't have an office. So we work, and for Chhattisgarh, I'm the contact person. Chhattisgarh, I'm looking after.
So Dr. Manjari had asked, can you share the link and contacts on our WhatsApp
Yes.
group?
Okay, Shripriya?
Shri
Can
Priya,
you
so
just-
there was a question from Dr. Manjari. She had asked whether we can share the link and contacts on their WhatsApp group.
Sure, will be done.
Yeah, because I'm not able to get it, copy it and store it. It will just, thanks. Yeah, thanks.
Okay, so previously there was a question from Dr. Shweta. So her mic has an issue, it seems. That's why she couldn't speak. So she works in a district hospital in Goa. So she was
Okay.
asking about the hands-on training.
Okay. So she wants to know who is our hands-on training partner in Goa, is it?
Yeah, I think so. That might be the question because she was asking about that.
Okay, okay. So
Dr.
any,
Shweta's question specifically was, how do we apply for hands-on training? I believe we already covered
I've
that.
answered. Yeah,
Dr.
yeah.
Shweta, since you are in the Goa region, you can get in touch after completing this foundation course. You can get in touch with the respective regional coordinator who will be facilitating this.
For Goa, you can directly get in touch with me. Yeah. Shripa, I think it will be a good idea if we can put it our numbers in the chat box.
It's already done.
Already done. Okay,
Yes.
right.
Me and Dr. Hashmat have already shared the regional coordinators numbers, the telehealth helpline number, and right now I have shared the directory. Palliative India, of course, as Sunanda said, Palliative India maintains a directory of our collaborators across India, and we have already shared that link in the group as well.
Yeah.
Regarding the hands-on, active hands-on training partners, once this program is over, after the 20th session, we will be sharing one PDF sheet with the contact details of all the available hands-on training institutes. That will also be done. We are waiting for these sessions to get over so that we will be sharing that updated.
Right.
There's one more question. Can a physiotherapist do this training?
No. This is only for the doctors. For physiotherapists, we have a customized training. So this is for the doctors.
We
See,
did
just-
have one batch for physiotherapist, which had run maybe 4-5 months back based upon the demand. And if still more demand comes in, we will definitely think about launching another batch for the physiotherapist, definitely. But as of now, our courses are tailored for a particular audience. Like if you are aware, if you know any physiotherapist who would like to, who is keen, who is passionate about palliative care, we would recommend that they may be, instead of waiting for the physiotherapist course, they can definitely take in the foundation course in palliative care for the general public, for the common graduates, which will give them more insights on the psychosocial aspects of palliative care. That would also be beneficial for them. So this was just a suggestion. A batch is going to start in January. So if you know someone who is very passionate about palliative care, who wants to know more about palliative care, you can definitely suggest that course to them as well. And Dr. Jo,
That course is in which language? For the-
English only.
Oh, okay. Yeah, okay. And if we want to have that implementation tip support, to whom shall I contact? Like being in Vadodara.
For Gujarat, I'm the person, ma'am.
Yeah, okay, sure. So I should contact you personally, right? Yeah, sure. Thank you.
Yes. Here, I just want to add few things since Shripya told about the directory. So I think I'll request all of you, instead of waiting for some person to get back to you, it's very simple. You go to our website, and when you go to our directory, all the states are mentioned. So suppose Jyoti ma'am, you go to Gujarat, you click on it, so you'll get a drop down list. So you get to know what are the organizations, palliative care services is happening around. So similarly for every state we have that. That is one thing. And when it comes to training, because what happens is sometimes maybe we have missed out to inform you. So regularly our trainings courses are updated in the website. So you can go to the website and click on the online. We have like on-site and online. So when you click on the online, then there's a drop-down menu for FCPM. The course that you all are having is, yeah, good. You can just
So
click on that.
this, I'm just taking them through the
Yeah. That'll help them. Yeah.
this one. If you can see my screen, the button on the right extreme bottom side directory. So once you click on that, I hope the screen is moving, Sunanda, as I click.
Yes. Perfect.
So, these are the details of states. For example, if I am clicking on Kerala, as you can see, this page will open up, wherein you will have the basic details of our partners which we have collaborations with the details. The name and address of that organization will be there, and the contact details of the person will also be there. So this is one thing which directory which Sunanda was mentioning about. Now regarding the training programs which Sunanda had told, once we move on to the training tab, you will find one training calendar here. So whatever programs are announced and those which are yet to be launched, the details will be available here. So the particular course which I was mentioning about just a few moments ago, the FCPC, the Foundation Course in Palliative Care Psychosocial Interventions. Once I click on that box, a new page opens up wherein you will find all the basic details of the course. The language, what is the schedule of the sessions, start date, end date, and the learning outcomes, the timing, what are the features. So all the details will be there. So this is how our website works.
And Shripa, I want to add one thing. Most of the participants do a mistake. Like there are two links because it's a paid training. So there's a link for registration and there's a link for payment. So sometimes people click on it and then they think they've registered. So you have to actually click on both the links because the links are separate.
Yeah.
Correct,
Once payment you can also make later after the session starts, but unless and until you register yourself, our team might not be able to identify your registration and get back to you. So that is how that is.
I have one, I want to tell you something about it. Can you please enlighten us on this? Hello?
Yes, please. Yes, go on.
See, you are talking about palliative care services, no? So
Yes.
in the fourth principle of palliative care is the justice, is the availability of resources. So can you please tell about this? So like specifically, all these services are to be given to these people and not to these people, because it is are you justified in giving these services to this population, and you are not justified to give these services to this population?
I think Dr. Hasmat will be the right person, Shripriya. Dr. Hasmat, if you're there.
Yeah, so the thing is like you are asking about the fair allocation of resources. So the thing is like you need to be very clear about it. It doesn't mean, I think we have a disturbance at the back. Yeah, if anybody has, can you please unmute? Yeah. So the thing is with respect to the fourth ethical principle, one thing we need to understand is palliative care is for all who has serious health related suffering. That is one thing. It doesn't mean that we are not going to give palliative care for this patient because he or she is in cancer, and for the other patient who has a non-cancer but with a serious health related suffering. So we are going to give palliative care for all who has SHS. And the other thing is with respect to the fair allocation of resources, it depends on the team's decision making capacity. For example, if I consider Pallium India, as I work in IP unit, I know how it is difficult to allocate the resources very clearly. And it's not me who decides it as a palliative care physician. It's me who puts few inputs for the team on what basis this has to be done. We have a social worker, we have other people working behind. So it's a team effort that we have a detailed discussion regarding one particular patient, and then we decide whether we are going to give this for him or her. So it involves a lot of teamwork, one thing. And whatever I said previously was we are going to give palliative care for everyone who has SHS, but with respect to the resources, it's a team's decision. Any more questions? And with as Sunanda was mentioning regarding the helpline. So we launched the helpline in 2021. We launched it because we had two principles in mind and two aim. One thing was to provide palliative care for people with serious health related suffering, not only for patients, but also for their families. And the second intention was to provide advice and opinion to healthcare professionals who reach out to us in case of any emergency. Like you are managing your own patient, you feel that so and so patient has needs for a palliative care, but you don't know how to manage them, so you are a little bit puzzled. You just don't need to stand. You can call the helpline number at any time from Monday to Saturday morning 9:30 to evening 4. You can reach out to the telehealth team and they will be able to help you on that aspect. Many of our our trainees who have trained from Pallium India, who went abroad or wherever they are, they reach out to us via WhatsApp or via the telehealth helpline number whenever they had a difficult situation in managing a patient's pain, in managing their psychosocial concerns and all that. So it is for healthcare professionals, not only for doctors, but also for nurses, social workers, whoever you may be, but you are working under a healthcare sector and you really feel that you need a support. So you can reach out to us on the helpline, and it's active from Monday to Saturday. So the two numbers that were displayed are the telehealth helpline numbers, and you can call on those numbers and reach out to us. We have a telehealth team, and they will be able to help you on that.
I will take up the question from Dr. Bharati. Ma'am, as of now, the volunteer training, particularly the volunteer training, is free of cost, which is a 5-day session, the basic session. And regarding the other courses, the fee details are already available at the website, or if you wish to know more about us, you are free to connect with us over call or WhatsApp. The volunteer training, particularly, it is free of cost. Any other queries which you feel we would be able to answer? I suppose if no one else has anything more to share or comment, maybe everyone can have their evening cup of tea earlier today.
Shreya, I was just thinking of something while Dr. Hasmut was sharing about the helpline number. So we as regional coordinators, we have experiences, especially me. So I want to just share here. I think it will be relevant. Since our helpline is Monday to Saturday, right, Dr. Hasmut? Yeah. So I just want to tell all of you, I get a call on a Saturday night at 8:30 from one part of the country because our numbers are in the website. So I do not look after South, but the call was from Hyderabad. So I just want to, share how, like, I'm a non-medic, okay, but how I was feeling when I was not able to help the person. So I just want to explain here. So I get a call, and it is a palliative care requirement of a lady who was having a ailing father. So they wanted to contact. Then I asked her, like, how did you get my number? So she has tried all the numbers, and then she got through me. So the immediate reaction would be next day is a Sunday. So like offices are closed and all that. So our team, like the state facilitation. So I contacted the southern coordinator, and then we contacted that region's all the our stakeholders, and from that they actually wanted a person to come to their house to visit because the patient is not in a position to move to the hospital or the hospice. So by Sunday evening, the team had reached. So I want to say, and I want to say that illness doesn't know about Saturday or Sunday. It can come any moment. So I think this is second or third experience for me. It always comes to me at Saturday or Sunday. So I just wanted to say, in that case, we all are there, like all the regional coordinators. If it's from any part of the, pick up the state and note our numbers, you call us. So because time is very important, it's very crucial. We need to act very fast. So I just wanted to request this to all of you. Don't wait. So we are there. I mean, many things can happen over through call and WhatsApp. So, and the team can reach, which has happened. It's my own experience. So I just wanted to tell you all that. Thank
I
you.
can totally relate to it,
That's really
Sunanda,
nice.
because
Thank
it was one Saturday night. I was on duty, and then I received a call from Arati saying that the patient has called from Telangana, and then Arati had contacted me at around 11 p.m. in the night. I was on night, and the family was very anxious, very, very anxious. So Arati had given the contact number. So what I did was I spoke to the patient and the caregiver. Actually, the daughter was the one who contacted us, and she was very, very anxious. And I spoke to her telling that let me find out if anything can be done. So what I did was I contacted Shri Priya that night. I think Shri Priya would be able to remember that. It was just a month ago. And then Shri Priya said, I told Shri Priya if there is any doctor who has finished their FCPM and coming from Telangana. So she was the one who was able to find out 2 doctors, and then I contacted them at 12 a.m. at night. And then one doctor was able to take up that patient. She said, tomorrow I'll go and see the patient at home. They were very, very happy. So I really feel that a lot of teamwork is there within Parliament too. Even at 11:30, when I was messaging Shri Priya, she was like immediately going into that and telling me, okay, these are the 2 doctors available. And then I actually thought at 12 a.m. I'm messaging a doctor, will she be able to respond? But the other person responded, and she was able to take it up. So don't hesitate. That is what I think Sunanda was about to say. Really don't hesitate. If you have any difficulties, you are now part of our team, and you can contact us at any time. We'll be there for you, as well as your patients and families.
So that's what I wanted to experience. I mean, share my experience. So that's why, with a humble request to all of you, then now that we are already considering you as our family members, please do respond to our odd time calls. Thank you so much.
Just now I came to know that Sunanda was the lead of that call because Dr. Hashmat had called me and
yeah, when she was saying, I was just remembering, she said Andhra.
Same.
I was totally able to relate that it was that Telangana patient at around 11 p.m. at night.
And that lady, as if I've done something, I don't know. I mean, I suddenly felt I didn't do anything, just a call. And she was like thanking me so many times. So what happens at that time? She needs a patient hearing. First time she just want to say, I mean, she was sharing her helplessness, and I gave her that time, and she was so happy, and the team reached them as it's a team effort. Everybody, Dr. Hashmat and Shilpi, everybody, kudos to you, and proud to be part of the team.
I think in this meeting only we are getting to know that we 3 were involved in that. Right?
Yeah, we don't know. Yeah.
Yeah.
Good. So thank you for listening to my experience, all of you.
If anybody wants to comment or wants to ask something, you can do that. Otherwise, we can wind up for today. So somebody has messaged, this is so positively encouraging to hear. That's really nice of Pallium India. I feel proud of myself being now a part of this team. Thank you so much. Amazing job. Thank you, Pallium, for the dedication. And Dr. Madhumita has also mentioned same here. Thank you so much, everyone.
Thank you.
That was
Thank you so
a
much.
very nice evening today with all of you.
Further to Dr. Ravi Shankar's comments, very informative. Like this is only the a tiny bit of information which we have shared with you. Yes, of course, this has to be a continuous process, a long process, wherein whatever we could do as part of our profession, for our passion we are doing, and we would definitely want everyone out here to carry on that baton, carry on this passion, and provide palliative care to whomever is out there in the world who is in need of your services. Because being a non-medical person, I can completely say with confidence that I will not be the one to provide pain relief to them. I can just be a part of that. Maybe I can share information, maybe I can point out to the correct person, but then as doctors, it is with you that the real battle lies, wherein you treat the complete person. So we do hope that this carries.
So, Shri Priya, I think you can make the closing note.
Sure. So thank you, everyone. I believe out of the 17 sessions, this one personally was very motivating for me, because I could hear such positive, kind words from some of you. So thank you so much for joining us, and thank you so much for listening to us, and thank you for assuring us that you will be part of this journey for a long time. So with that positive note, this is Shri Priya along with Ms. Sunanda Samal and Dr. Hashmat Phagana signing off from the Tips Eco Hub. See you in the next session with another entirely different topic and another experienced faculty. Till then, everyone, take care. Bye-bye.
Thank you. Stay safe. Bye-bye.
Bye-bye.